Alzheimer's disease pathology in your brain starts 20 to 25 years before you start having any memory symptoms. So by the time you start having memory symptoms, it means all your cognitive reserve has ran out, that it cannot compensate for the damage that has accumulated. But if you do this XYZ things, you will develop disease in 30 years. So that's what I want to get to, that point where I can do the testing and can tell you what you can do in your particular situation to delay the onset of dementia. But I do want to give some basic neuroscience overview of why things happen. Then it makes sense that what we can do to actually prevent it. So by the time I see patients, they are already in this stage, which is a mild cognitive impairment or dementia. The third group of people I see, they already had a significant moderate to advanced dementia, but now they are having psychological symptoms like behavioral symptoms of the dementia, and then I end up seeing them. But the horse is out of the barn, right? You can't fix it at that time. You have to start it much, much earlier. So as you can see, this is a time scale. Alzheimer's disease pathology in your brain starts 20 to 25 years before you start having any memory symptoms. So by the time you start having memory symptoms, it means all your cognitive reserve has ran out, that it cannot compensate for the damage that has accumulated. So it needs to start really early, but the same token, it's never too late. Like even if you have a good amount of accumulation of pathology, even in our patients with moderate to advanced dementia, we have seen when they implement lifestyle interventions, they can either slow down or in very rare cases even reverse the progression in some patients. It gets really confusing, the word dementia and the Alzheimer's disease. Most people think that Alzheimer's disease is an advanced stage of dementia, but which is not true. Alzheimer's is a pathology or the cause of dementia, and dementia is a clinical syndrome where a person is not able to do things that they were able to do very easily before. And there are multiple different kinds and stuff like that. And my problem is with the definition, because currently we are defining dementia as once already persons start having symptoms. As I said earlier, it's been already too late by the time you start having symptoms. So it's like defining that somebody has a breast cancer when they are stage 3 or stage 4 breast cancer. Can you imagine doing that? That not even calling something a breast cancer till it has spread all over the body and you're about to die? No, we won't do that. Look at the survival rate. If you're stage 4 brain cancer, your survival rate is 16%. If you're stage 3 brain cancer, breast cancer, your survival rate is 52%. And that's why our dementia survival rate sucks, because this is how we define. Imagine if we define dementia when already a person has a significant pathology, obviously they are not going to do well. That's why we have to start much, much earlier. So what I envision, like what should happen in next 10, 15, 20 years? In next 10, 15, 20 years, if you are 75 years old, and you know that that's the age you're going to develop dementia, because that was the average age your parents developed dementia. That's statistically, that has turned out to be true. Like if you want to predict what, if you did everything exactly what your parents did, on average, people develop dementia around the same age that average age of their parents developed. Now, it's not always true, because people don't live exactly same lives as their parents did, right? Some people's parents smoked and they did not, and so many variables. But on average, what we will do in future is 25 years before your expected date of onset of dementia, we screen you. We do this genetic test, we do the screening test, and then say, based on your current history and biomarkers, you are going to develop the disease in next 15 years. But if you do this XYZ things, you will develop disease in 30 years. So that's what I want to get to, that point where I can do the testing and can tell you what you can do in your particular situation to delay the onset of dementia. Are we there yet?
Yeah.
Unfortunately, we are not quite there yet, but we know what this XYZ is. So we know the interventions, we just don't know how impactful particular intervention is in your situation. But 90%, we know 90% of interventions we already know. But the science is very tricky, right? Scientists will say, this may be possible. Like if you're an influencer, you say things with certainty. So the less knowledge you have, more certainty you have. And the more knowledgeable you are most likely humble and say, it's possible and most likely. That's why research articles don't come out and say 100%, versus influencer says, take this prevention and your dementia is going to be cured, right? Why do I have a picture of Angelina Jolie? So if you have a stage 3 or 4 breast cancer, or you're just worried about it, you can go ahead and get a mastectomy done. I'm not sure we're going to sign up to get our brain taken out, but as you may know, 2 out of 3 patients with Alzheimer's disease are women, and 2 out of 3 caregivers or more are women. So in the past, we used to just blame it to that, oh, women live longer and that's why they have more Alzheimer's disease. That is not true, because women does not live that much longer to have that high of an impact. And I have almost 30-minute video on this on YouTube, so you can check it out. Now we are able to do the test for it. So we have biomarker tests that we can do, that I've been doing it for almost 2 years or longer, and you can test your blood to see if you have Alzheimer's protein in your brain or not. It's not a 100% test, and it only tests for a small portion of the problem. It doesn't look at your cognitive reserve aspect. Essentially, how much knowledge we have. So we have this journal of prevention of Alzheimer's disease. And this is not a new thing. It's been around for, some slides are not showing up. That's fantastic. And it's been around for 11 years. So the first journal publication happened 11 years ago. So imagine for how many years we have been publishing articles that Alzheimer's disease is preventable. And for general population, or even some doctors, they don't even put those 2 words together. Like if you tell somebody that Alzheimer's is preventable, they will look at you funny, like, what's wrong with you, right? Like, we have never heard of it. Fortunately, nowadays in many news media, you read 1 or 2 articles about it, that, oh, you do this, and it can reduce the risk. But I think it should be even louder. There was a recent study, a US pointer trial. So if you have not looked it up, that's something to look up. US pointer trial that has shown that in general population, you can reduce the risk of dementia. And that was the largest trial done in US so far in Alzheimer's prevention.